Hello and welcome to Pandemic Tech News. My name's Rich Tarani. Thanks for watching. This is a program that talks about all types of technologies that are going to help society get through this and future pandemics. Social distancing is a new normal, especially when you are a medical worker treating coronavirus patients. And those people who show symptoms of the disease tend to shed a great amount of virus when they breathe or when they speak or if they cough. And the viral load that they tend to give off is higher than someone who may have gotten the disease and may not even know about it. So healthcare workers really need to be careful, and they need to limit their contact with coronavirus patients. As a result, the Mount Sinai Hospital in New York is using Google Nest cameras to monitor patients. This is a take on telemedicine technology where you can remotely see your doctor, and we think it's a great idea. And coincidentally or incidentally, it's the same kind of situation that we're going to see in offices for a while, where large numbers of people don't pack into conference rooms, but will actually be in the same building, maybe even on the same floor, and we will have conferences electronically via Zoom or Microsoft or Skype or whatever it is that we use. Now, Amazon has been at the center of controversy lately. In many of its warehouses, there have been a few protests by some of the workers. There have been some that have gotten sick, a few deaths, and the company has committed to keep its workers as safe as possible. They're going to spend $4 billion on technology, which will keep workers safer. Some of this technology is AI embedded cameras that enable you to determine the social distance between workers. Also, you'll be able to tell if one or more of them have temperature. They also have robots that have UV lights on them that can disinfect large areas of space at one time. And we expect to see some of this technology make its way to Whole Foods in the future as well. So be on the lookout for those things. So if you watch the daily press briefings, you hear the media ask numerous times a day about testing. They do their best to make it seem like no matter how many tests there are not enough. I mean, I always feel like it's some kind of gotcha situation. Okay, there's 1 million. Why is there not 2 million? There's 2 million. Why not 3 million, etc. And the sad part is watching them getting absolutely no value from this daily discussion of the same questions every single day. They really are correct, but they're not really describing to the American people or the world what the issue is. Testing doesn't work effectively unless you can test every person every day with immediate results. For example, the city of Wuhan wants to test 13 million people at one time. So great idea. They're going to do it. They're going to test 13 million people. Then what happens the day after the test when someone gets infected and it starts to infect large numbers of people? Once again, no one really knows who is infected, who isn't infected. We're back in the same situation. So testing has to be constant. In order for this to take place, there's some good news, not great news, but some good news. We're going in the right direction. The FDA has approved the home saliva coronavirus test developed by Rutgers. I personally was extremely excited when I saw the headline. I thought it was great because it's exactly what we need, what society needs to function. That's the good news. The bad news is you have to send your saliva to a lab, and you have to mail it, and then the results are determined and they'll let you know. So hopefully future tests will be immediate. Once that happens, companies like Clear, they're the biometric ID company. You likely have seen them in airports, back when we used to go to airports or stadiums. They have kind of like a rapid line that you can get through quickly because it pretty much proves who you are biometrically via different factors, whether it's your fingerprint or whatever you happen to use. And they are now offering a coronavirus screening named Health Pass, and it's aimed at businesses. It will also be useful for airports. It'll be useful for stadiums. So it's really they're a logical company to get into space, and we see it as a natural transition for them. And as we get better testing, this is exactly what will work to get society back to normal. Now, contact tracing is also needed if society decides it wants to get back to normal with a minimum number of infections. Currently, tens of thousands of people have been hired to do this by hand. It's a very tedious process. You need to find out by interviewing every person who may have gotten coronavirus or who now has symptoms or who has tested positive. You have to find out who have they come in contact with, for how long, and in what circumstances. And you just go along the line. You find out from those people who have you come in contact with potentially, and you want to kind of keep a log of all this. You can just imagine this grows very quickly. We reported in a past episode that Apple and Google have teamed up to allow phones to handle this task, which makes a lot more sense. Of course, there are privacy issues. There are a lot of people that don't trust the government with this information. They certainly don't trust Silicon Valley with this information. Basically, they trust no one with this information. So it's going to be a push-pull, because if you don't have enough people using contact tracing applications, they really don't work. So actually, some experts have said that in the US and in Europe, it's going to be tough to get enough people to use them. But having said that, it was interesting to me to hear that Trump's economic advisor, Kevin Hassett, he recently said in an interview that there's no downside in implementing a national coronavirus tracing system. It leads us to believe that there will be a related announcement coming soon. So stay tuned for that. So now that we have all the systems to ensure that we can test and we can keep track of testing and we know who has been with who, the issue becomes what happens if someone new comes to town and they haven't been tested. Well, Hawaii has gotten their coronavirus testing under control, and they have an interesting idea. Visitors to the island currently are supposed to spend 2 weeks in their room in quarantine. It's not really the best way to spend your vacation, especially since most vacations are 1 or 2 weeks anyway. Since people have not been obeying the quarantine, they have a really interesting idea. They considered putting GPS-enabled ankle bracelets, the kind used for prisoners, on people visiting the island. The state attorney general objected for some reason. We'll try to figure out why. On that note, this is Rich Tarani. I'm signing off. I hope you enjoyed this episode, and I hope to get a few more broadcasts in before my next Hawaiian vacation, where they'll likely throw the vacationers and honeymooners in jail for a few weeks to make sure they keep away from